I actually grew up wanting to be a public health worker. In the first few years in college, I spent a lot of time both here in the US and internationally looking at public health systems, infrastructure development, economic development. And what I learned during that time was I'd go someplace and they would hear public health and they would assume they were healthcare workers. And we would look around, no clinicians in sight. So I thought, wouldn't it be interesting if I actually became a clinician and I could do public health work as a clinician? So I went to medical school and then practiced emergency medicine for about 10 years, a little bit over 10 years, because it was such a portable skill that you could take anywhere. And then as I was practicing in Baltimore and Washington, D.C., what I learned is I could fix individuals and help them while they were in pain, having a stroke, having a heart attack. But you would see the same folks, it was a revolving door. And I was looking upstream and thinking, what else can we do? Which led me to what I do now in professional services, which is look at individual problems that organizations or consumers or we as a society have and try to move to a solution that's as far upstream as possible instead of just putting bandages on cuts and after the injury has already happened.
So I guess your move to Deloitte had to do with sort of wanting to look at things in a sort of systematic as a way as opposed to a patient at a time.
Exactly, and I'll tell you, patient at a time is extremely fulfilling and gratifying. But it's also extremely frustrating when you see the same person coming back in because they couldn't get their medication fulfilled or because they lived in poor housing and they're housing insecure and therefore their medical problems were causing them an issue. Quite frankly, the genesis of my transition was as CMS was looking at pay for performance in the 90s and 2000s. What I saw is healthcare organizations struggling with how do we actually solve for this in a way that puts the consumer at the center and allows us to also continue to be financially durable. And I called CMS and had a conversation and joined a committee, second committee, and really that's how I kind of got pulled out of doing clinical work into finding ways to solve for the systemic issues.